Hi listeners, Jason here. We are excited to finally announce registrations for the biggest psych health and safety community event ever. The inaugural The Psych Health and Safety Conference will be held at the Sofitel Wentworth, Sydney, June 19 to 20, 2024 and offer concurrent virtual attendance. It'll feature live podcast recordings with OG researchers including Christina Maslach and Michael Leiter of Burnout fame, Psych Health and Safety USA podcast host I. David Daniels, Australian super experts including the likes of David Burrows, a special 10-year anniversary integrated approaches to workplace mental health panel with authors Tony LaMontagne, Angela Martin and Kat Page, hand-picked case studies from organisations doing it well, and a very special interview with plaintiff Zaggy Kozarov by Catherine Dunlop on that High Court case which we previously covered on the podcast. This event will sell out. Get in quick to secure tickets at early bird prices for the 2-day conference, pre-conference masterclasses, and the VIP dinner. The first 200 in-person registrations also get a copy of her latest book, The Burnout Challenge, signed by Christina Maslach herself. Find out more and register at www.psychhealthandsafetyconference.com. Now, on to this episode.
From Flourish DX, this is the Psych Health and Safety Podcast. With workplace mental health becoming a safety prerogative, this is the source of information on psychological injury prevention and health promotion.
Hi, and welcome to the Psych Health and Safety Podcast. My name is Jason Van Schie, and I'm one of the hosts of the show. The aim of the podcast is to rapidly increase the knowledge and application of psychological health and safety in workplaces worldwide. Today marks a brand new segment for us, where we are joined by an academic who will help us to understand a recent publication of theirs and how the research can be translated into practice. I'll pass on to my esteemed co-host Joelle Mitchell to make the introductions and get into it.
So our special guest today, his career has been dedicated to developing the scientific and public understanding of work as a social determinant of health, and translating this research into policy and practice to improve workplace and worker health. Specific areas of interest include workplace mental health, improving job quality and psychosocial working conditions, and evaluating policy interventions. His research has influenced policy and practice in workplace health both nationally and internationally, including OH&S authorities, mental health NGOs, the Australian National Mental Health Commission, the US Occupational Safety and Health Administration, and the World Health Organization. Welcome back to the podcast, Professor Tony LaMontagne. How are you today, Tony?
Very good. Thanks very much. Thanks for the intro.
How's your day going so far?
Oh, not too bad. I'm just off a bit of writing and into a little speaking.
Excellent.
Good to mix it up. Tony, great to have you back on the podcast. This is really exciting for us. It's a new segment that we're trialing. Couldn't have asked for a better guest first up to talk about this, but aiming to get through, what people are researching and what they're publishing in 15 to 20 minutes, getting past those dastardly paywalls that many journal articles sit behind. I know the one we're going to talk about today is open access, but this is hopefully a way for academics like yourself to really be able to share, I guess, what's so exciting about the research that they've taken all that time to go through peer review and get through to publication. So we're going to ask you later for some recommendations of some other academics you think we should have on the podcast to talk about their research.
Yeah, can do that. Dob a few in. Yep.
Yeah, nice. So the paper we want to talk about with you today is titled Work-Related Causes of Mental Health Conditions and Interventions for Their Improvement in Workplaces. Sounds like a good fit for the show. It was published in the Lancet in October 2023. So I guess, first of all, what were the drivers for conducting this piece of research, Tony?
Well, it's a synthesis piece, and it was commissioned by the Lancet. They first contacted my colleague Rainer Regulus, who's the first author. He's at the Danish National Institute for the Research on the Work Environment, and the senior editor there, a senior exec editor, Jessamy Baganel, became interested in work and health, particularly from a social determinants perspective. And she identified some leading figures in the literature, went to Rainer. Rainer's quite a leader in the etiologic research on psychosocial hazards and mental health, meaning the exposure outcome relations, and then I do some of that, but also a lot of intervention work. What do you do about those identified associations? So Reiner came to me, among others, and tried to get a collection of international experts in the area, and then we developed a paper over a long time and a lot of peer review.
How long did it take, Tony?
Oh
Dare I
gosh,
ask?
now you're stressing my memory. I think we had three rounds of peer review, and usually the response was longer than the paper itself. And so I think it was over. It was at least a year, maybe it was, and then you got to wait a while after it's accepted before it gets published. So probably a year and a half. I can't quite remember.
Yeah, and just reminds me again why I never wanted to be an academic. Um, we're very
Yeah, it's a long-term thing. Yes,
yeah,
it's a
we're
long game.
grateful to people like you, Tony.
Very much so. Very much so. All right. So the TLDR, too long didn't read, in 5 minutes or less, Tony.
Too long didn't read. Okay, it's basically the paper's in two parts. So what's the evidence that psychosocial hazards harm mental health, and then what can we do about it? And in the first part, we focused in particular on psychosocial hazards and mental health for the etiologic research. That is, what evidence we have that low job control, high insecurity, bullying at work induces or creates new depression in workers. And that's incident depression as opposed to prevalent depression, which is a bit of a subtlety, but it was important for all of the debates about whether these associations are causal or are they artifactual, or is there some other explanation for these associations? And long and short of it is that the evidence is very strong that there's a causal link between psychosocial hazards and incident depression, particularly for job strain, effort reward imbalance, job insecurity, occupational violence, for examples. And some other papers, if these associations are causal, and they've controlled for a lot of confounders and improved designs, the longitudinal studies, different methods for measuring outcomes, different methods for measuring exposures, all of which that evidence is pointing in the same direction. Is it perfect? No. Observational studies are never perfect. We can't randomly assign people to get job insecurity or not, thankfully. We can't do that. And so, the evidence base isn't perfect, but it's quite strong. And if those associations are causal, some estimates from other work are that around, say, 17 to 35% of depression in workers would be attributable to job strain, ERI, insecurity, and bullying at work. That's from a study of 28 countries and 35,000 workers in Europe. So it's big. And my view, it's adequate information to justify action. So what's the action? That's the second part of the paper, which is the intervention story. And there we started it out by summarizing, in our view, the integrated approach is a good framework to pull together all the different things one would like to see people doing in workplaces to protect and promote mental health. And that you're very familiar with this because we've done a session on it in the past. But the integrated approach says we want workplaces to protect mental health by addressing work-related causes in particular, and it can include other interventions. We want to promote the positive aspects of work, and then we want workplaces to respond in a timely and non-discriminatory manner when people show signs of mental distress. And so here we then summarize the intervention evidence around addressing psychosocial factors. And job control is probably some of the most consistent evidence that when we improve job control, we can improve mental health. And that's fantastic. But at the same time, we have to acknowledge that the evidence base is biased towards individual directed interventions. And what are those? Those are things like resilience training, employee assistance programs, Are You OK days, and so on. These are important elements of workplace mental health, but you can do randomized trials fairly easily by randomizing individual workers to an individual directed intervention, educational or skill building. But it's much harder to do studies where you have to randomize entire work units or entire companies to an intervention program or not. And those would be organizationally directed or work directed interventions. And These are much more susceptible to disruption by the usual factors out there, such as downsizing, state of the economy. They're much more complicated and involve multiple changes, from the intervention to the change in working conditions on the ground, and then ultimately to improvements in mental health. And so that's something that we have to acknowledge, though the evidence in that space is getting better all the time. And Birgit Aust from the Danish National Institute recently published a review of reviews, an umbrella review, if you will, of interventions on organizationally directed strategies to improve worker health and mental health.
Yeah.
So if we come down to the nub there, there's good evidence of what to do. It is a combination of principles-based and evidence-based. So in public health, we know that primary prevention, the source of the problem, addressing the source, as well as secondary and tertiary, are important. And those sort of correspond to working condition directed or work directed intervention, worker directed intervention, and illness directed intervention. And so we know this from the hierarchy of controls in OH&S, as well as other bases. Where we are now in this space is that there's a proliferation of information on this out there, as you would know very well. And some of it is evidence-informed and evidence-based, and some of it is not. And it's a real challenge for a mindful employer to be sifting through that. And what some of our recommendations at the end of the paper are around what we think needs to happen in policy. Yes, we do believe that regulation is indicated, and it's happening around Australia, state by state, territory by territory, as you know. But the thing that's missing is we know what to tell people to do, improve job control, but how do you do that? It's tough. So for a well-intentioned employer to try to improve job control for a convenience store clerk versus a police officer versus a primary school teacher, those are context dependent. They depend on the worker, the nature of the workforce. Is it unionized, non-unionized, large or small workplace? There are no off-the-shelf solutions. And this is what's a real challenge for workplaces, to tailor their intervention strategies to their workplaces in collaboration with their workers. And that's what's really slowing things down, in my view, at least amongst those employers that are willing to have a go. And so we stress the importance of improving implementation guidance along with regulation in order to make these changes and rebalance the focus in workplace mental health onto working conditions as much as on workers and illness. And that's pretty much the summary of the paper.
Do you need more psych health and safety in your life? Then head over to the FlourishDX Academy for several free on-demand e-learning courses. If you're an internal professional, follow FlourishDX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the FlourishDX Academy. www.45003.org. Now back to this episode.
Well done, Tony. That was very concise.
Yeah, and Tony, I think you've even answered the next question as well, which is around what were the main conclusions and recommendations. So, anything else to add?
I think, I'm just having a little quick squiz here. That some of the points we also make is urging NGOs and others, such as the World Health Organization. There was some guidelines published last year on work and mental health that are quite valuable. I served on the guideline development group for that, and what we've done with our recommendations at the end of the paper is we've tied it to specific reviews that were done in the WHO guidelines, which are quite valuable. They did a whole series of systematic reviews. So one of the points we make is the importance of targeting low status workers. These are the workers with the worst psychosocial working conditions and also the least likely to experience any form of preventive intervention. As we go around, mostly what we see in general, and this I'd value your opinion on this as well, is that organizations with high value employees they want to hold on to, are much more likely to do all sorts of flexible work practices, workplace mental health programs, including perhaps even some work directed intervention and not just are you okay days and flexible schedules and things, and less likely to invest in lower status workers, casual workers, young workers. And that can actually result in exacerbated inequalities in workplace mental health. So that's one of our points, and there's a few more, but in the interest of not going on too long, I'll stop there because I know you also want to ask about future work in this area.
Yeah, and Tony, we should probably catch up. We do have this large data set we just collected with 11,000 responses from retail workers. So it kind of aligns really closely with what you're talking about there. So,
Yep.
I won't give away the findings yet.
No, that's good. That's good. I'll be interested to see that when it comes out for sure. Yeah.
So I laughed when we decided to include this question because I always think that it must just be so annoying as a researcher when you've just gone through such a effortful process of undertaking an academic research project, from ethics approval through to actually doing the research and then everything that's involved in publishing. And then people say, hey, that's great. What are you doing next? But that is great, and we would like to know what you're doing next.
Well, that's fine because there's one chunk of work that I've been developing in collaboration with people, researchers around the world even, and that's on work and suicide. So the evidence that psychosocial hazards are risk factors for suicide is building steadily. And the thing about psychosocial hazards is that they're very common exposures. So even a small increase in risk in association with job insecurity or sexual harassment, for example, or job strain, those can translate to large preventable burdens, as we heard with depression, but also with suicide, with cardiovascular heart disease, with burnout, with premature mortality, with health behaviors, and so on. So the work and suicide piece, it really end up in the same place. The evidence is strong there. The same gaps exist in workplace suicide prevention, tends to be very much focused on early detection and getting people the help they might need, both of which are critical and important things, but not very much on the working conditions that can contribute to that risk. And so we urge a rebalancing of intervention efforts in workplace suicide prevention to encompass the full integrated approach. And also I should say that in doing so, workplaces might have a variety of different programs that come together like a puzzle to cover off different aspects of suicide prevention or workplace mental health, whatever the case may be. And so, it's acknowledging that not every single program or initiative needs to include everything, but a workplace needs to put together the pieces and make sure they've got it all covered in their overall approach. And that's one of our main messages from the work and suicide piece. So we did a white paper on this for Suicide Prevention Australia that came out last year with Tanya King, who's a co-author with me from the University of Melbourne. And we then put that out to our collaborators around the world, about 19 of them. It's a small group, herding cats, as you could imagine. And surprise, surprise, the paper grew in scope and length, and but also in quality and comprehensiveness. And that's under review, and we hope that'll see the light of day not too far into the future. And that's really targeting policymakers, a synthesis piece again. Because, for policymakers and practitioners, reading the empirical studies, it's hard, it's tedious, it's technical. And what people need who are out there on the coalface is, what does it mean for me? What can I do with this information in my day-to-day working life? And that's what we're trying to do with the work and suicide piece that's forthcoming.
Definitely an important piece of work, because I do see a lot of people still challenging the idea that work might actually lead to suicidal behaviour or be a contributor. So I think having that that single source that says, well, here is all the evidence that actually supports this this conclusion is is definitely an important piece of work. And as you say, I think, the benefit there is that if we're addressing psychosocial hazards broadly at the root as far as possible, then we're going to have positive impacts on multiple outcomes, including suicidal behaviour, including depression. So the further back we can go, the more impact we're going to have from a public health perspective. So fantastic.
True. And it's interesting that, when we talk about psychosocial hazards, even in the current regulatory environment, they tend to focus entirely on mental health. Now, that's understandable from a regulator's perspective because it's what's driving workers' comp claims increases and driving some work cover authorities towards bankruptcy, such as Victoria. However, it also increases the risk of cardiovascular disease, stroke, burnout, premature death, adverse health behaviors. And so it's just adding another reason to be promoting, psychosocial job quality, as well as individual directed interventions to make people more resilient, better able to handle stressors, to get people the help they need early in a timely, non-discriminatory fashion. And then we'll have all the pieces hopefully working together with better outcomes for working people.
Tony, you're a legend. We really love your work. You're doing very important work, like you mentioned, which is around taking all of that great research, which is sometimes hard to read, hard to really put into practice, and you're helping to bridge that gap for practitioners, so and policymakers as well. So thanks for that, and thanks for being the first guinea pig to come through and do this.
That's all right.
Short roundup. Great.
My pleasure. My pleasure.
And we're looking forward to seeing you, Tony, at the Psych Health and Safety Conference in June later this year.
You will. I'll be there with bells on. Yes.
Yeah. Looking forward to it.
Excellent.
All right. Well, that's it for today, listeners. Thanks again to Tony, and we hope you got out of it. The link to this piece of research will be in the show notes. So we'll catch you next episode.
You've been listening to the Psych Health and Safety Podcast. To stay up to date with the latest on psychological injury prevention, follow Flourish DX on LinkedIn and subscribe to the Psych Health and Safety Podcast at www.psychealthandsafety.com.